biggest topic of discussion in recent days, coronavirus, from the city of Wuhan in Hubei province of China. That is what we talk about world over. And in Sri Lanka, in recent days, we see that there is a lot of panic and fear. But of course, the government continues to say that there is no reason for panic. However, we thought of talking to the World Health Organization with its representative officers present across the world and also in Sri Lanka. I thought they would be in a better position to tell us about this situation. I've invited to our studios Dr. Razia Pendse, the representative of the World Health Organization in Sri Lanka, who has extensive experience, 15 years working in public health, and your doctorate in pediatrics from the University of Rajasthan in India, and also a master's in public health from the University of London. I know you don't like me talking about your academic background or your experience, but first, welcome to our studios at Hyde Park.
Thank you so much. Thank you for having W.H.O in the studio today.
Dr. Pendse, coronavirus. Yesterday we heard the Chinese President Xi Jinping addressing the nation, saying that it had reached a situation where urgent address, out of hand the situation was, that is in China we're talking about. But the World Health Organization has not yet declared the outbreak a public health emergency of international concern, although there is a lot of concern, fear and panic, as I said. Let's start off there.
Okay, before we go to the public health emergency of international concern, for the viewers to know what is coronavirus. So these are a large family of viruses which cause a range of respiratory diseases, from common cold to severe acute respiratory syndrome, the SARS as people know it. These viruses generally are they're in animals, but once in a while there is a switch from animals to human, that we call it a jump, and that's when they cause disease in humans. The current outbreak, which is largely confined to China, and as you mentioned, it started in the city of Wuhan with people having these symptoms of respiratory disease, and now we have this disease, a few cases outside of China also. And now that you ask me why WHO has not yet declared it as a public health emergency of international concern, because it is not WHO that makes a unilateral decision. There is an emergency committee on, we call this a novel coronavirus, because we do not yet know a lot about it. It's a new virus. The WHO Director General has met with this committee twice, and there is a meeting again today in Geneva, where all aspects of the disease, its spread, and does it constitute a public health emergency of international concern? This is discussed in the last two sessions of the committee. The committee advised the World Health Organization that it had not reached the level to be called a public health emergency. Let's wait and see. The committee is due to meet today again, and we will have the outcome of the committee today itself.
A large city of China is under lockdown, and deaths have been reported and many affected. I'm unable to give the exact numbers because these keep updating. Why would the WHO not declare this as an emergency situation or an outbreak of that requires urgent international attention? And also, how serious is this in WHO's view?
WHO is, all three levels of the organization are working together with all our counterparts, and especially with the government of China, to see that we are able to contain this epidemic, this outbreak, and especially we need to contain it in China and contain its spread to other nations worldwide. So it's not like WHO is not taking this seriously. WHO is very serious about it, from the highest levels to right at the people on the ground who are working in the affected areas. So we are taking this very seriously, and all efforts that are needed to contain the outbreak and to limit the spread, so that it doesn't become a major outbreak are being taken. There's a lot of collaboration going on with other countries, with other institutions, so that we can know more about this virus. As I mentioned before, this is a new virus. We don't know a lot about it, and unless we know more about this virus, we will not be able to give the right kind of advice on what needs to be done. That's why it requires a lot of collaboration and cooperation, from getting information on the clinical data to the various virus genome sequencing, which actually has been shared very quickly by countries. That has enabled countries who have had these cases rapidly diagnose them by developing the tests that are needed. For instance, in Sri Lanka, the one case that was identified as positive, that was through a local reverse transcriptase PCR reaction test, as we call it, that was developed by the Medical Research Institute here with support from a WHO collaborating center. So there is a lot of collaboration and cooperation ongoing.
We'd like to talk more on that, but Dr. Pendse, let's move on to talk a little about the virus itself. I know you started giving us an outlook into what disease. It's a novel virus, yes. We know very little, but in the WHO's opinion and knowledge, how far back does the information relating to coronavirus date? When did you first hear of this? And because there are a lot of reports that there were symptoms, this was under experimentation. There were a lot of lab investigations ongoing. Now, this is the kind of social media comments, rumors that are spreading. But formally, how far back does your information date?
So the first cases were reported starting in December of 2019, and these came from the affected areas. And since then, WHO was on the alert to see what this disease is, what is the cause of this disease, the causative organism, how it has happened, and where it came from. So WHO has been on the, had its eyes on the disease as it emerged, because it appeared to be a new disease, and and we have been following it, and as the disease, we got more and more cases.
But was there any mention in 2017 of a virus of this nature?
No. The first case of the novel coronavirus, as we call it, is December 2019.
And in Sri Lanka, of course, we see face masks being used by individuals, and some opt not to. But in China too, and internationally, when we see visual footage sent in from international media, that face masks are used frequently. In the recent days, just a couple of days back, it was declared that face masks are not a necessity, because the spread of this virus not necessarily is airborne. How would you explain to us about this?
So, before moving into the face mask, let me just elaborate on this virus, where the reservoir is generally an animal. Previously, when the SARS has happened, we had identified that there was the wild animal civet cat was there, and then when the Ebola came, it was the bats. In this particular case, we do not yet know the animal reservoir. So there are efforts to identify. And then, as I said, that the switch happens from animal, it goes to human. And we have now some instances of human-to-human transmission. Some cases have been said. So this is how the mode of spread of this disease is. And what is most needed, because it's a respiratory disease, droplet infection. And one thing which really helps prevent spread of this disease is personal protection measures, frequent hand washing. It sounds like common sense, but that is the most effective way of preventing spread of this disease, preventing yourself from getting this disease.
Basic hygiene.
Basic hygiene, which has absolutely, and everyone has to practice that. Washing hands and having respiratory hygiene, What do we mean by this? Is when you're coughing or sneezing, ensure that you are covering or doing it in the curve of your elbow, and after that immediately wash your hands so that droplet spread is limited. Then, because we know this is an animal reservoir, so we need to ensure that especially when we are having meat, it is properly cooked, and that we have again our hygiene and personal protection while handling especially raw meat.
Right.
These are some of the things which are very, very important. Coming to masks.
Before we talk about masks, Dr. Pendse, I think it's time we take a short commercial break, but it's very important that we talk about this. We'll return to speak of protective measures that could be taken in the face of what's happening internationally. Welcome back. You're joining us at Hyde Park, and we're talking to the resident representative of the World Health Organization in Sri Lanka, Dr. Razia Pendse. Dr. Pendse, yes, you were explaining to us protective measures that could be taken individually in order to contain the outbreak or the spread of the outbreak. We were about to speak about the use of face masks, protective masks. How important is this?
See, while wearing medical masks may help prevent spread of disease, but it is no guarantee that this will help you prevent contracting this disease. Because mask alone is not sufficient. It has to be associated with the hand hygiene and respiratory hygiene I talked about. The other thing is that if you're wearing a mask, you get a sense of false security or protection, and you may not use the other protective measures which are more important. In Sri Lanka, we have one positive case, and according to the World Health Organization, use of masks by general public is not indicated. Who should wear masks? If you are suffering from respiratory diseases. So if you have cough, fever, or respiratory difficulty, or if you're handling a person who is having these symptoms, or if you're a health worker working in health settings where you are interacting with patients who have these signs and symptoms. So there the use of mask is beneficial and must be used. For general public, I reiterate, it is not needed. And even when you wear mask, appropriate use, and how do you wear it? Keeping the mask on your face, then proper removal and proper disposal. All these things are important. So also so many people wearing masks. Now in some cultures, it's okay. So we see in some countries, we have people, even when there's no disease or kind of an outbreak, people continue to wear masks. I don't think so in Sri Lanka we have this culture of wearing masks all the time. So it also creates a sense of panic. So we have to balance what is needed to what is a kind of a rumor or kind of false information that is going around. This leads to panic in the citizens, which should be avoided at all costs, because panic does not help prevent the disease. Right measures will help in preventing the disease.
170 dead internationally, 7,700 individuals affected worldwide. In Sri Lanka, one positive case. But in Sri Lanka, you continue to reiterate that there is no necessity to have unnecessary fear or panic. Why do you say that? The outbreak, the ability for the outbreak to come into Sri Lanka, what measures are being taken? How positive are you of this situation given the measures taken in Sri Lanka?
This is not the first infectious disease outbreak that Sri Lanka is facing and addressing. It has addressed infectious emergencies in the past. There is a very good surveillance system that the country has to identify and to take measures in order to contain the spread of the disease. As I said, that even with the numbers, and the numbers are changing by the day, the important thing is to have the preparedness and then the response capacity of what needs to be done. Even before this outbreak happened, WHO works closely with the Ministry of Health and the Disaster Preparedness Unit, as well as the Disaster Management Center, to ensure that the country is well prepared to address any emergency of this sort. So we have all the necessary stockpiles, what is needed in terms of protective equipment, in terms of the guidelines, what needs to be done at the central level, at the provincial level, at the peripheral level. Now, what the health system will do, what the messaging to the public is. So currently in this present situation, we are working very closely with the Ministry of Health to look at the preparedness in the hospitals, to also look at the different stockpiles, what could be the anticipated need, to see does the country have it. If required, then we can quickly mobilize our international networks to get the supplies that is needed. We don't see any kind of a huge gap here. The preparedness is very well. It has been monitored from the highest level. It has, there is a task force within the Ministry of Health. The Director General Health Services is monitoring it. The epidemiology unit is tracking. One case was identified and quickly also tested positive. This information was quickly provided to the World Health Organization. And for travelers who are coming from China, the measures have been instituted in order to track these people to see if they develop symptoms, so that measures could be taken. So I would say that the country is geared up and is prepared in order to address if there is even, possibility of more cases coming in.
There's concern that it is only the hospital in IDH, the infectious diseases hospital, that only has the capability to address a situation in a possible outbreak in Sri Lanka. What's the WHO's observation of Sri Lanka's hospital capacity?
As per our latest discussions with the Ministry of Health, we have 12 hospitals that have been identified and prepared in the event that there would be more cases, and more cases would require hospitalization. And just to tell you that even with the huge numbers that you are saying, because as of the reported to WHO in the morning, it was, as of last evening, was 6,065. The 20% of these are cases which have serious symptoms requiring hospitalization. And around 2 to 3% is the case fatality rate, is the number of people who are serious and have died. So still we have large proportion of people who are having mild illness. So it's not that anybody who contracts this disease will require hospitalization. So the preparedness is there, and as I said, there are 12 hospitals that have been identified to provide the necessary services that would be needed.
Yes, talking about that renowned respiratory expert, Dr. Zhong Nanshan, who's known as the SARS hero, he stated at a recent press conference in China that he does not believe that the outbreak could claim up to 65 million lives as is being reported in international media. Yes, as we're talking about unnecessary panic being exerted around the world globally, people are also waiting for something significant or something solid to be heard from health professionals or from the WHO, the reason why we have you here today. And in Sri Lanka, as you mentioned, seeing people in face masks creates unnecessary panic, which is why our authorities have come out to say, no, there is no necessity for it. But again, it needs to be stressed how we can prevent, and especially for children and for the older and vulnerable. How would you identify these groups, and what kind of preventive measures they can take apart from those very important general measures that you spoke about?
So especially people who are vulnerable, like young children, elderly, or people with pre-existing diseases, or like pregnant women, besides taking all these personal protection measures, is to avoid crowded places, because that's your chances of exposures increase, and to be vigilant. If you feel that you are having some symptoms, immediately seek care. And if there is travel history to any of the affected areas, it would be important to share that with your health provider, because that will help in taking the necessary steps. Because you see, cough and cold and having respiratory difficulty is any kind of respiratory illness would have that. That includes the novel coronavirus. So it's important to give all the information, to be vigilant, to take all the measures that need to be taken from on a personal level, and seek the health care in time and appropriately. Also, we should not overcrowd hospitals, because if you have symptoms, then only go, because going to and just overcrowding the hospitals also increase your chance of getting the infection.
Right. Let's remind the symptoms too when we come back after a short break. Do stay with us at Hyde Park. Welcome back. You were talking about why we should be mindful not to overcrowd hospitals, not to rush into hospitals out of panic, only if we see clear symptoms of this virus that you're talking about, that we are talking about here. If we very quickly remind our viewers, Dr. Pendse, what symptoms we need to look out for, what we need to worry about, and what we should not.
So if you have fever, cough, and respiratory difficulty, immediately seek care. Seek your health seek care with your health provider, and follow the guidance that has been given.
So we don't have to worry about anything else, as we hear on social media, eyes. I mean, there's so much that is spoken of, and you outline just in one sentence respiratory difficulties. And if there are any related issues, seek medical assistance.
So it's like, it's like any flu. So if you have fever, cough, respiratory difficulty, seek care. The thing is that if you feel that, oh, I'm having a mild fever and I may be having coronavirus, because sometimes this is how the panic comes. So panic doesn't help. Action will help.
Let's talk about the remedial measures that are taken to not just contain the situation, but address and to make sure that this virus is actually prevented, and what medical tests are ongoing in order to address this situation.
So as I had mentioned before, this is a new virus. We are still gathering more information, and that's why surveillance, data collection, getting the epidemiological information of this virus, doing some modeling exercises, getting the clinical data so that we can have the best public health advice for people in terms of protection, as well as in terms of clinical case management when an individual is found positive of this disease. This is ongoing. There's a lot of research that's happening in identifying the virus, what it is, what is the animal reservoir, what is the how as we call it the reproduction, the R0, that what is the transmissibility of this virus, what is the severity of the disease, and all this will help getting us better information to understand and give the guidance. So from WHO, we already have created an open platform to get all the clinical data from different sites. These are anonymized data, so it cannot be traced to individual people, so the data protection is there, and that will help us better understand. There is also a mission of experts that will be working very closely with authorities and experts in China to get better understanding, so that we can have better guidance for global response to this outbreak.
The incubation period of this new coronavirus is still unknown, but experts are working under the assumption that the period is roughly about 12 days. But is it known whether there could be this virus could be transmitted from human to human during the incubation period of 12 days that is assumed?
So currently it could be anywhere between 2 to 14 days. And that's why if there is an exposure history, that we recommend that the person should be then isolated for 14 days to see if the symptoms appear. And yes, you are right that there have been reports of some cases which were subclinical, as we say, that the person did not have symptoms initially, but have transmitted and then only later on developed the symptoms. So it is possible, but we are still awaiting better data to actually give a recommendation in terms of what the incubation period is and what the transmission pattern of the disease is.
If you move to talk about Wuhan, the city where this virus originated, it's under lockdown. What is the WHO's understanding and of the welfare and the well-being of the people of Wuhan, especially because we have 33 Sri Lankans also in the city, along with other nationalities and Chinese nationalities who are under lockdown in the city?
WHO does not have any recommendation in terms of the measures that, because these are sovereign decisions taken by the government in the best interest of their people, and we respect the decision of the government that has been taken in the affected areas or in any other country. And we believe and we feel that this is something which the country has done it in the best interest of their citizens, and also to ensure that the disease can be better contained and better addressed.
In terms of Wuhan, again, we know that a large number of people are in lockdown, under lockdown in the city, but how can we ensure that the safety of these people, especially when we say there are infected people, because this is also a fear of the families of the 33 Sri Lankans who are inside that city, who are not able to move out of the city. Food and water, they say, is a problem, but authorities continue to assure that food and water supply will be ensured. But I'm sure that the WHO too has a lot of observatory missions in those parts of China.
So we had a high-level mission headed by the WHO Director General, and there was a press conference last evening which was addressed by the WHO Director General and the Emergencies Director. And what we gather from the mission and the reports that have been shared is that the preparedness and the response of the Chinese government to the outbreak is right from the, it starts from the President of China. And as so far as what I have heard from coming out from our headquarters is that the response that the government has taken there is what needs to be done. And in terms of now social media and the rumors going around, I don't think so we should be providing guidance on the rumors that go around. What we need is evidence and the right information for the right recommendation, and that's what WHO is working closely with the authorities as well as the experts and researchers.
In terms of the trials that are ongoing, Dr. Pendse, to figure out what kind of vaccine would help contain this situation, what is the positiveness of the WHO? Do we have a time frame? I know it's not easy to say that medical tests are ongoing. You gave us an outline of what kind of collaborations the WHO is engaged in and scientific medical tests ongoing, but a vaccine, that's what everyone is waiting to hear.
As I mentioned in the very beginning, that this is a new virus. That's why it's called the novel coronavirus 2019. We are still trying to understand the virus, and that will help in identification of the right kind of treatment, because still we do not have any specific treatment for this. It's supportive treatment of cases, and the vaccine development is also based on understanding the genomic sequence and the structure of the virus. And I'm sure that there is there will be ongoing research to develop a vaccine, as happened in the case of Ebola, for example.
We'll take a short commercial break and return to talk more after this. Welcome back. You're joining us at Hyde Park. We've been talking at large, at length on this novel coronavirus. But of course, there are other health concerns. Are we forgetting about that? There have been concerns even before the emergence of this virus. While this is the immediate attention and issue that the governments around the world and the WHO will give attention and prominence to, what other areas specific to Sri Lanka is the WHO looking at? Because until we spoke about coronavirus, there are other issues, dengue and other health concerns that the WHO may have had, or positive strides that Sri Lanka has taken. Let's touch on that and remind our public that we should not forget about those either.
That's a very good question, and I think so. Even though this is kind of an immediate need that needs to be addressed and taken care of, but that doesn't mean that all other activities in the health sector in terms of prevention of disease, health promotion, health and well-being is neglected. I've been here for almost 2.5 years now, and the health sector in Sri Lanka is one of the good examples and a better example in the region and globally in terms of providing free health services. And one of the major challenges that people in Sri Lanka face is actually non-communicable diseases. And 83% of the deaths in Sri Lanka are because of diabetes, hypertension, cancer, chronic respiratory diseases. And these are all the diseases that have modifiable risk factors, meaning thereby that people can actually prevent them. So healthy diets, physical activity, getting screening done, taking the treatment that is required so that you can control whether it is high blood sugar or high blood pressure. And so WHO has been working very closely with the Ministry of Health, and in fact it was just on 27th January that we had launched our a health corner in our office, and we had opened it to other partners as well as the Ministry of Health. We'd work closely with the Ministry of Health to do that, so that people take charge of their own health. And staying healthy is more important. And we often confuse wellness and illness, that okay, care of and control of disease is care of illness, but wellness is staying healthy. And it's interesting that illness starts with the I and wellness with a we. So if we work together, we'll be well and less ill.
That's certainly a nice way to approach the World Health Organization's mission and of all health authorities and medical professionals around the world. I'd like to come back to the coronavirus. I know I wanted to move out and speak more, but something I forgot or I was unable to ask you earlier on was about the sudden loss of consciousness. We saw several videos circulating on social media, individuals fainting in a loss of control and consciousness. What is this? Is this related to the symptoms and effects of coronavirus, or is this totally unrelated?
So in times of outbreaks, there's a lot of rumor mongering that happens. And with social media, it just has a multiplier effect. So it's very important for people to really make sure that whatever they are seeing, that it merits their attention, because there'll be a lot of these things that will be going around which is not true. In fact, this could be information which would be more harmful than beneficial. So for people, it's very important to know where to seek the right advice, the right information, and validated information. So WHO, our website, is accessible to everybody. Just type who.int. The landing page will give you the coronavirus site. all information that you would need to know in terms of your personal protection, advice to public, from laboratory investigations, case management, home-based care of people suffering from this disease. Everything is available. So I would urge people to seek the information from the WHO website. In Sri Lanka, the Ministry of Health has done a wonderful job. The Health Promotion Bureau on their website and their Facebook page are having all the information that the public needs to know. So it's important for people to seek the information from the right and validated sources rather than just looking at these social media forwards, which only create panic. If there is an information that they feel that they're reading it and they are in doubt, they can reach out to us. We have our office here. Please reach out to us if you find that there is information you need to know more about. Or there's also the Health Promotion Bureau, and they have opened it up and they have a Facebook interactive page. WHO is also present on the social media. We have a Twitter, we have Facebook, we have Instagram. So please, my plea to people would be, seek information from the right sources. Don't go by whatever circulates on social media. Don't panic. Be vigilant. Take action. Don't react.
Don't panic, don't react, take action, be vigilant. Very quickly, if we remind our viewers and the general public once again, Dr. Pendse, what preventive measures they can take to address this situation other than the very popular face mask that everyone is resorting to.
So, hand washing, before food, after you've been to the toilet, after you've had sneezing or coughing, if you have been outside, you're coming back, frequent hand washing is important. Respiratory hygiene, cough in a tissue or cover your face or in a crook of your elbow. After you've sneezed or have it, wash your hands. If you are sick, having fever or cough, avoid going to your place of work, or if your children are sick, don't send them to school. If somebody is sick, avoid contact if you feel that there is. So basically avoid contact with places where there may be sick people, for example, hospitals. Avoid crowded places because you may not know who is having those that infection. And just being vigilant of our surroundings. And because this is an animal origin, handle your animals or meat appropriately, and cook your meat properly so that there is no transmission through the food that we eat. So safe food practices, respiratory hygiene, hand hygiene, these are some of the things which will help you prevent. And although this is an animal reservoir, we don't know yet what the animal is, but what we know is that the common pet animals like cats and dogs, they are unlikely source of being the reservoir of this virus. So don't shun your pets. As of now, we don't know, but very soon we will be knowing what the animal reservoir is.
Right. As health authorities globally are closely watching the outbreak of respiratory illness that has caused panic and fear, the WHO continues to say that we do not have to panic. And I'm thankful that the resident representative of the Sri Lankan office of WHO has joined us here at Hyde Park to share with us your views and thoughts on the ongoing situation, and thankful to note that in Sri Lanka the WHO believes and is confident that all measures necessary to prevent an outbreak has been taken by health authorities and the government, as the WHO continues to collaborate and work closely with health authorities. Thank you very much for your time with us here, Dr. Pendse.
Thank you very much.
I'd like to end with something that Dr. Pendse said: be vigilant, do not react, but act and take preventive measures. We'll see you again next week at the same time at Hyde Park.